Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is a very special guest, Dedi Gilad, the co-founder and CEO at TytoCare. How are you today?
I'm great. Thank you for having me, Jared.
I'm excited to have you here. I was telling you just a second ago, I love seeing your logo when I'm at the airport. It's become part of my travel now.
So very happy, really.
Let's dive right in. We usually keep these short and sweet. So you can go through a variety of questions, but let's start out with give us a little bit about your background, and then we'll talk about TytoCare.
Sure. So I'm engineering background, studied in Israel and did all of my life in the tech industry, various companies, starting with Microsoft, but moving to different companies. And in the last, I would say, 15 years, I'm on the healthcare side, which is kind of a bug. Once you start doing healthcare, it's very hard to go to other industries. Two kids, wife living in Israel right now, but was living in New York for 3.5 years just before COVID. And if I jump to Taito, if we take a step back for a second, Taito started roughly 10 years ago out of a really personal need. I had my daughter back then was 4 years old. She was going to a kindergarten in Israel, which is the first year you go from 7 kids in a class to about 30, and she suffered from a lot of repeating ear infection, throat infections. Eventually, she had a small surgery to fix that, but during that time, I'm responsible for the kids in the morning. My wife manages schools, and I was finding myself almost every 3 weeks going to the pediatrician with the same ritual. And it was really annoying. I don't like, waiting in line, everybody sneezing on you, and eventually you get a very basic diagnosis. And this is how Taito actually started. Speaking with my pediatrician, with my daughter's pediatrician, and learning what he's doing and trying to really replicate that to the home. So the concept of Taito is really to take the physical interaction and shift it or replicate it to the home. We obviously grew that meaningfully in the last years, and I'll be happy to speak more about that.
And so give us the where the company is at today, the core overview, the different I guess pillars of the company, and what's really exciting you about where things are at today.
Sure. So TytoCare is in the space of home primary care, virtual care. This industry exists for like 20 years, but suffers from some very basic limitations. You can only do so much when you are dealing with video and audio. This is what the industry is doing for a while. And there wasn't very nice uptick and improvement, I would say, during COVID, just because population couldn't go out. But post-COVID, you see a back to reality going down in terms of utilization. The actual fact is that utilization-wise, people don't use it enough. 5 to 10% of the population are using that after a lot of investment into that space. And Taito really changes that metaphor by bringing what we call today the home smart clinic, a way for you, for a family, not to a specific patient. We are the basis or the core solution for every potential household, the common denominator, if you may, that can allow you to run full remote visit exam, whether it's an urgent care visit at night or a primary care scheduled visit, monitoring of chronic patients, and all the way to hospital at home. So we can really treat most of the medical situations and care modalities from the comfort of home. We are supporting today about a little bit over 900,000 patients. About 30,000 clinicians are using the system. We are active in 13 countries, but the majority is in the US. About 70% of what we do is in the US. And we are working not directly with patients or consumers. We work with large health organizations, payers, providers, pay providers, any organization who take risk in terms of the insurance side, and providing medical service is potentially a customer or a partner of Tyto. And from there, what is unique about the solution is that we are getting in a B2B2C to the consumers. Uh, Tyto, if we look at our solution and what we bring to the market, beyond the examination itself, the ability with one kit, one device, to run the full capabilities of physical exam from home, meaning imaging of the throat, the skin, the ears, the eyes, auscultation, recording of the sounds of the heart, the lungs, the stomach, and some basic vital signs. All of that are done by a person, a mother, a father, a family member at home, either to themselves or to their family members. And clinician remotely can actually diagnose based on that data. And actually, we are becoming the remote hands and ears and eyes of this clinician. What that brings to the market is a lot of trust, which is missing. Healthcare in general and primary care specifically is a lot about psychology and trust. And this is part of the limitation in general telehealth. The fact that you are talking to a physician that you probably don't know and you will probably never see again without any ability for them to diagnose you, to examine you, reduces the level of trust. And unless it's really important for you or you don't have any other options, you would not do it too much. With Tyto, we are seeing 5 to 8 times utilization. People are doing a behavioral change slowly. It takes time, it's complex. We invest a lot into education, into engagement, but the actual results is that we are shifting that behavior.
Now, when it comes to the future of remote care, through your lens, talk us through, some of the. I know you really mentioned to how you're, impacting the space, right? But let's dig into also what issues still exist that you're working to solve in the future of remote care, and then, fast forward, couple months, couple years, what does that future of remote care look like through your lens?
Sure. When we started, the core impact was around urgent care, a very small element of the continuum of care. Middle of the night, weekends, when you need somebody to take care of yourself or family member. Today, we are supporting more and more modalities of care. And on top of this baseline of primary care that we did from the beginning, we are now providing verticals for asthma management, for hypertension, for pregnancy management, times in your life or your family life that you need more of a protocol, that the system can actually not wait for you to be sick, not wait for you to be, for this visit to be episodic, but to bring a protocol that can help you manage your care automatically. With that, we recently got the first FDA for our lung sounds analysis, which gives us ability to diagnose automatically wheezes and crackle and so forth. So part of this protocol, let's say kids with asthma, we're now starting to introduce programs that the system automatically will alert clinician about degradation in your condition, about degradation in your child's condition of asthma. And this can help people manage their health without going to see the doctor, or even worse, without going to see the ER. So these are areas that I see Tyto focusing much more on the, I don't really like the term AI. People are using it so much without a real credential, but I think it is a huge, the machine learning capabilities of what we do are really unique. Just because we're dealing with a very, very basic information type, those images, videos, sound recording, allows, when we have those in millions and we are harvesting, if you want, from hundreds of thousands of patients, this data, all obviously secured under HIPAA, it's their data, but we have the ability anonymously to analyze the information in the background. We are starting to learn so much from that. So this is for me the future, not so far away. So not in the long term, but in the near and mid term. I'm not saying that we will replace clinician. We're not even aiming for that. We're trying to be very realistic, but we will be able to give more and more insights and alerts and decision support tool to those clinicians.
Yeah, I think when people talk about the fears of AI, right, and saying, "Oh, we're trying to," no one's trying to get rid of these, these the clinicians. We're not getting, but if we can equip them with more information to make faster decisions, that takes away too some of the worst parts of providing care, right? The documentation and the additional research, right?
And I would even say more, Jared, and this is a very good point that you're mentioning. I think what is unique, at least for me, in what Taito machine learning or AI is talking about, is that typical AI in healthcare is algorithms that are looking around a lot of data and trying to make very tedious and long work very quickly and find those areas that maybe clinician might miss. In our case, we're doing even beyond that. We are tagging the data with specialists. So for us to analyze lung quizzes, we are using best in class pulmonologists and cardiologists and ENT physicians, and we equip that knowledge to the plain PCPs. So if you talk to a pediatrician, they might have learned about, fine crackles in med school, but in reality, they don't see that phenomenon too often. When we have a lot of data and we tag it with specialists, we actually giving them the tools of the specialist to the front line of primary care. And this is very exciting.
And one of the other things that's really exciting is, this bring continuing to bring care in the home, right? It's something that was talked about. It seems like it's talked about every day now, but for the longest time, we didn't talk so much about it as a healthcare community. You were ahead of the curve in, seeing this future of where care is heading. But talk us through in terms of like primary care, right? The importance of being able to provide primary care within the home and what that means for your patients.
We took a big bet when Taito started. We took a big bet of taking, not the low hanging fruits usually in healthcare is that you take a very small niche of area, very small amount of patient, and you're trying to solve a very a restricted problem. Taito took on itself, when you deal with primary care, it's again the common denominator. Every household, Taito can technically meet, and work in any household, whether you are a student, learning or studying in some remote state, whether you're going on a hiking or whether you have family with kids or whether you are a senior living. So this common denominator, on one side, it's hard to get because you're not really treating the most expensive areas, and it's very wide problem to solve. But once you manage to get to the engagement level and to the adoption level, you can start build the point solution on top of that. Companies that took the opposite approach and took point solution and started from let's do only diabetic and only hypertension and only this and that, health organizations are being hammered with tons, many solutions, many platforms, very hard to integrate all of them, and it's chaotic. So bringing the bases to the home, I think it's a very tough. We are still in the works of making that really the real basic for everyone, but we are on our path to do that. That's why primary care is so important because it touches everyone, because it can help you in your day to day on many occasions. And on top of that, a common denominator, we are building those additional layers or floors, if you may, on those infrastructures.
What's exciting you about, what's next with TytoCare that you can share with us today? I know there's some stuff you probably want to share and you can't, right? You have to keep it close to the vest. But tell us what you're excited about moving forward with the company that get us excited as well.
Two areas. One is really to start, which is obvious, to start seeing more and more results and value to the insight module of Taito, those AI capabilities upon the data that we collected. We are very unique in that data. It's data that you cannot go out to Mount Sinai or to Kaiser Permanente and just buy it. Nobody holds that kind of information, and this is very exciting what we can learn from that. But beyond that, in this continuum of care, we're looking how to be more prominent in the house, meaning Again, we started with the episodic care. When you have to wake up and say, I don't feel well, I want to see a clinician. We continued to the monitoring of chronic condition upon protocol. So there's a protocol managing your health, but we want to be much more always on, I would call it, something that is helping you to monitor on a day to day. I cannot go too deep. We are now acquiring a company in that space that can help you monitor specific population, whether these are toddlers or young babies or very specific chronic patient over a long period of time passively, and giving us help with the insight, with the prediction of their condition. So instead of them waking up and say, I don't feel well, or the protocol tells them once every week or once every 2 weeks, do this and that, and we will let you know, we can see more subtle changes, whether it's overnight or during the day, in a passive way without interfering to the lives and getting more information. So this is where we're trying to this is what excites me. It will take some time. I'll be happy to notify you when we are closing that deal and we can share.
Would love to have you come back on, and when the deal's ready to be announced, we can dive more into it. But really appreciate you coming on the podcast here today, sharing your thoughts on a couple topics with us, and hopefully we can have you come on, talk about that, and then would also love to have you on a panel at some point where we could talk more about care in the home and where things are heading. I think that'd be a ton of fun. Wish you and the team the best of luck.